Diastasis. Odds are you've never heard the word, but there's a real chance you're walking around with it right now. And here's what surprises people. Most folks assume this only hits women after childbirth. Not true. Men get it. Kids get it. Women who've never been pregnant get it. And if someone told you the only fix is surgery under general anesthesia, I need you to stop and hear me out, because that could be the most expensive mistake you ever make with your own body. I'm Sam Waterling, and in 15 years with patients, I've watched people get talked into operations they never needed. Nobody's going to lay this out for you at your next appointment, because the system earns when you stay sick, not when you sort yourself out at home. Subscribe and hit like if you want the straight version. Help Dr. Waterling reach 300,000 subscribers. Let me tell you what diastasis actually is. The full name is diastasis recti, and all it means is that your abdominal muscles have separated. Picture the front of your belly. You've got two long straps of muscle running down the middle, one on the left, one on the right. People call them the six-pack muscles. Down the center, joining them, runs a band of tough tissue called the linea alba, which is Latin for the white line. That white line is not muscle. It's connective tissue, the same stuff your ligaments and tendons are made of. Its whole job is to hold those two muscle straps tightly together in the middle of your body. Now here's the key. That white line is wrapped in broad sheets of connective tissue called fascia. Fascia is like a wide, flat covering that surrounds each muscle in front and in back. And in the middle, all those sheets fuse into one strong seam. That seam is what keeps your belly wall firm and closed. But if that seam is weak, if the tissue is loose and slack instead of tight and springy, then under pressure it starts to spread. The two muscle straps drift apart and a gap opens right down the middle of your stomach. So what pulls that white line apart in the first place? The single biggest cause is pregnancy. Over 9 months, the womb grows and grows and grows, and it slowly stretches every tissue in the belly, the white line included. Now, if a woman's connective tissue was strong, elastic, and springy to begin with, then once the baby is born and the womb shrinks back down, the muscles pull back in, and the white line gradually tightens up again and closes the gap on its own. But if that tissue was slack and weak to start with, it stays stretched out. It just doesn't spring back. The separation can be small or large. 2 centimeters, which is a little under an inch, or 3, 4, 5, even 8 centimeters, which is more than 3 inches. I want to be clear on one thing. A small separation above the belly button, roughly 1.5 to 2 centimeters after childbirth, is completely normal. Honestly, it's often just a sign that a woman has given birth at some point. That's nothing to fix. That's biology. Now, I have to warn you about the 2 big mistakes people make with diastasis. The first mistake is trying to fix it with the wrong exercises. If you have diastasis, you must never ever do exercises that lift your torso or lift your legs off the ground. Here's why. When you lie flat on your back and lift your upper body or lift your legs, your belly bulges out harder right away, and the pressure inside your abdomen shoots up. Then, as you keep pulling your rib cage toward your hips, you push your internal organs down even more, and the pressure inside climbs higher still. Every time that happens, the white line gets stretched further, and the gap gets wider. So the classic sit-up, the classic crunch, the move everyone thinks builds a flat stomach, is exactly the move that makes diastasis worse. With this condition, those exercises are off the table completely. Don't do them. The second mistake is rushing into surgery. When a woman has a noticeable separation, 4, 5, 8 centimeters, she's usually offered an operation to stitch it shut. Most of the time it's done through a keyhole procedure, small punctures. They go in, sew the muscles back together, and sometimes add a mesh to reinforce it. On the outside, it looks fine, it holds, it sounds like everything's handled. But surgeons themselves have a saying, and they mean it. The best operation is the one you never had. And here's my honest position, backed by what I've seen with my own patients. In the large majority of cases, almost always, diastasis can be closed without surgery. And it doesn't take some heroic effort. Think about it. On one side of the scale, you do a few targeted exercises, you strengthen your connective tissue, you take a couple of supplements, you fill in a nutrient gap or two. On the other side, you put yourself through the full weight of surgical risk. You take general anesthesia, which is always a shock to the body. Anesthesia is chemically switching your brain off, and it can mess with your memory and your mood afterward. And every operation leaves scar tissue behind, and scar tissue pulls and tightens the body toward it for years. So the way I see it, you should make every reasonable effort to dodge the knife first. And honestly, the effort involved isn't huge. And here's the bonus. Everything you do to close the gap also makes you healthier overall, not just in your belly. So let's reframe the whole goal. When we set out to close diastasis, what we're really doing is strengthening connective tissue. And I want you to follow this chain of logic because you can trace it without a single lab test. If you have diastasis, then you have weak connective tissue. If you have weak connective tissue, then you probably have a condition called connective tissue dysplasia, which simply means your body builds this tissue too loosely across the board. And that usually comes with low vitamin D and shortages of key minerals, the raw materials your body needs to make strong tissue. Now, the ideal path is to actually get your blood work done and sit down with a doctor who reads your results and starts closing those gaps. As your tissue gets stronger everywhere, every exercise you do closes the diastasis faster. And here's something you have to get. When your connective tissue is weak, it's basically impossible for that weakness to sit in just one spot on your belly. It shows up everywhere. That's why weak connective tissue travels with a whole crowd of other problems. Varicose veins, those swollen ropey veins in the legs, hemorrhoids, organs that sag downward inside you, stretch marks on the belly, the thighs, the back, anywhere. A heart valve issue called mitral valve prolapse, where one of the heart's valves is too floppy and doesn't close tightly. Bad nearsightedness, trouble with your teeth, your nails, your hair, joints that crack and bend too far, all of it traces back to the same loose, weak tissue. And if you've had some chronic illness nagging at you for more than a year, that's a loud signal that your metabolism and your connective tissue need attention. So when you spot diastasis, you can now see it's really telling you something bigger. You start fixing the whole system, and in a strange way, you can actually thank the gap in your belly. It pointed you toward the real issue while there was still time to fix it, and closing it makes your entire body stronger, which means a longer, healthier, sharper life. Now, prevention. We've established that diastasis shows up most often in women after childbirth, and we've agreed it's not really the pregnancy itself, it's the weak connective tissue underneath. Still, to keep diastasis from forming or getting worse, I'd tell every woman after giving birth to wear a support band for the first 2 months and then wear supportive firming garments from 2 to 6 months. Here's the reason. The moment the womb empties, the space inside the belly suddenly shrinks, but muscles that spent 9 months stretching can't snap back into place in a single second. They stay stretched, and in that window, they need help. And outside support takes some of the load off them and gives them time to slowly, gently draw back together. Before I give you the exercise, let me say something about age, because it matters here more than people realize. After 40, your body makes new collagen more slowly, and collagen is the protein that gives connective tissue its strength. That means the same gap closes faster in a younger body and needs more patience in an older one. So do me a favor, drop your age in the comments. I genuinely want to see which age group most of you fall into because it changes how quickly you should expect results and how I'll shape the next videos for you. Now let me give you the best exercise I know for diastasis, and I only teach things I've tested on myself. The logic couldn't be simpler. If you want a flat, pulled-in stomach, then pull your stomach in. That's it. That's the whole idea, and here's exactly how you do it. Pull your belly in as far as it will go. Pull your belly button back toward your spine and hold it there. Don't let it out. Keeping that stomach pulled in tight, you start pulling even harder in short, sharp pulses, trying to suck the belly button in deeper and deeper. You can breathe out in little short breaths between the pulses, but in those pauses, you never let the belly relax. How long do you do it? You go until your body says, I can't do anymore. Until the muscles start to fail and cramp, and then very slowly you release the tension. Even if you do it just once at the intensity I'm describing, you'll feel your stomach tighten and pull in a little right away. Here's how it works on the gap. Those two muscle straps that drifted apart with a little window between them get firmer and tighter as you train them this way. They start pulling back toward the middle, and bit by bit they close that window. I've seen women who were scheduled for surgery with a gap of 7 or 8 centimeters more than 3 inches. Do this exercise for a single month and find the separation had shrunk so much that surgery was off the table entirely. Do this exercise at least once a day. I tell everyone to do it, whether you have diastasis or not, because we all need a strong lower belly, a solid foundation for the whole body, and the beauty of it is you don't need a special position. You can do it lying down, sitting, standing, and you can even do it while walking. That's what makes it so valuable to me. It asks for nothing, no mat, no equipment, no privacy. When you're out for a walk and you remember it, you just start pulling that belly in and you're doing your body a favor. If your diastasis is large and obvious, do it 3 or 4 times a day, 3 or 4 sets each time, going until the muscles start to cramp. That's when you get the fast results. And I'll tell you straight, I've seen it again and again. No matter how many times you've given birth, 1 child or 5, you can get your stomach into excellent shape. It comes down to the right exercises and the right effort, and this is the main one that gets you there. Tell me in the comments how you feel right after you try it. Here's your takeaway as your doctor. If you have a gap, stop the crunches and sit-ups today. They're making it worse. Start the draw and exercise once a day, more if the gap is large. Get your vitamin D and minerals checked. Treat the gap as a message about your whole body, not just a cosmetic flaw. Do that, and in most cases, you'll never need an operation. One last thing before you go. Your doctor probably won't sit you down and walk you through any of this because there's no money in a patient who fixes herself at home for free. I'm telling you anyway because that's exactly why this channel exists. Subscribe, leave a like, and help Dr. Waterling grow to 300,000 subscribers. We're building something real here, one honest video at a time.